Hi, everyone. Good afternoon. Thanks for joining us for our next version of Community Connections. So if you tuned in last month, you know that I had the opportunity to meet with Mike Ritter, who works for Domestic Violence Intervention and does some work with a group called Connected Together. And we talked about adverse childhood experience. Today, I'm happy to have Holly Dolan with us, and she's going to share a little bit about a program called The Basics. And so I'm happy to share this. I know a little bit about it and have been involved in some work. And so I'm happy to have Holly here with us today. Holly, you want to just take a minute and introduce yourself?
Hi, Brooke. Thank you so much for having me today. Yes, my name is Holly Dolan. I'm the Director of Education and Outreach at Lebanon Family Health Services. And we've been working with the basics for a number of years. And we've recently also, of course, been part of Connected Together, trying to implement the basics throughout Lebanon County. So thanks for having me on today to share with everybody a little bit about what the basics are. The basics actually are an initiative that originally came out of Harvard University many years ago and is starting now to grow itself nationwide. And we are really proud that Lebanon is the very first basics community in Pennsylvania. It is called the Basics Lebanon Valley. So essentially what it is as it's grown nationwide, it's the communities have realized the value of a common goal of coming together to foster healthy, strong families and children and citizens. And really, the basics are fun, simple, and powerful ways that every parent, caregivers, individual can interact with every child to help them have a strong and meaningful start to become productive citizens. These very simple tools really encompass most of what experts say is important for intellectual and cognitive development of the young child's brain, and also developing in all areas of development, including social and emotional learning and intellectual development. So what the basics are, they are free tools that are available on thebasics.org. There is a website out there. And you don't need any kind of tools or toys. It's kind of simple things you can do to integrate into your everyday life as a parent, a caregiver, or any citizen that interacts with children. And it's based on 5 pillars of just different things we can do to interact with children. So the 5 pillars are maximizing love and managing stress, talking, singing, and pointing, counting, grouping, and comparing, exploring through movement and play, and reading and discussing stories. So as you can see, all kind of little cool interactive tools that you can do to foster healthy development for a young child, because we know learning happens so much in those first few years of life.
Yeah, what I really love about this program is, as I shared, we talked a little bit about adverse childhood experience and the long-term effects, negative effects that can have on a person's health outcomes, mental health outcomes, ability to learn and just be a functioning member of society, that they can really inhibit those things. And so what I love about the basics is it really is a strategy to help prevent some of those things and focus on our youngest community members. I think this is geared in the early ages, birth to 3 or even up to preschool. And it's a real tangible way that the community can rally around our youngest citizens and say, there's something for everybody to help reinforce positive relationships with caregivers and family and positive brain development. So I think for me, this is something that's very tangible that everybody can kind of rally behind to prevent some of those negative things from happening and really just build resilience and a buffer for these children. So Holly, why do you think the basics are important in Lebanon County?
That's a great question, Brooke, and it's exactly what you just said. It's a great way for all of us to get involved in positive development, because we know that 80% of brain growth happens in those first years of life, those vital years of life. I always say my favorite baby picture are brain scans of a developing child's brain, because you see that as a child grows from infancy, say to age 3, and even be up to when we're 5 in kindergarten, we're ready to do kindergarten, we see all the dendrites of the brains connect. And there's massive brain development, I would say 80% in those first 3 years. But the way they happen are because of interactions. that a child has with a parent, a caregiver, or any other meaningful adult in a kid's life. So there's so much all of us can do and play in the role of connecting all those dendrites, because all those dendrites come together to make a kid ready to learn, to be kindergarten ready, and make them into productive citizens.
Mm-hmm.
Sadly, we do see that there are gaps. There's developmental skill gaps for some children along the lines of race, ethnicity, and socioeconomic status. And it's very clear in national data. Some of the data that we see, for example, that that children who live in families where there's higher education and a higher income level, they hear 30 million more words by the age of 3 than children that are living in lower income families. And that plays that role in those dendrite connections in the brain. But likewise, it's not even just the number of words, but it's also the quality of the words and the type of words that they're hearing. So likewise, we see that children who live in lower income families that may not get as much interaction also don't hear as many words of praise. We see kids who are in higher income families see 10 times more words of praise versus things like reprimanding, warning, holdings. So we know that these positive words of reinforcement, many words, and positive words of reinforcement contribute to those positive dendrite connections that make a child kindergarten ready, and also bonding with the parent and caregiver. And sadly, we also see that the data and the research also shows that this catches up with a kid over time. This stuff grows over time. So if you're hearing 30 million less words by the age of 2 and more reprimands, it has a long-term impact that we see by the age of 17. So when a kid now is ready to graduate high school, there is a 3 to 4 year gap in terms of intellectual development and learning. And those things then also translate into economic income later, because we know that if they have higher academic achievement, they're more likely then to go to college, to get a job that will pay them more, and to be in a more economically better position in life. So these things are so meaningful. These meaningful little interactions have a massive outcome later in life for a child to get a college degree and to have a higher income and to have a higher quality of standard of living. So to come back to your question on why is this important for Lebanon County, the United Way has obviously identified what we call 5 ALICE communities, which you know all about this, the asset limited, income constrained, employed, which means there's a lot of families out there that are working really hard but not able to make ends meet. So they are stressed and they are having challenges with income. And so we know things like these basics tools can be so helpful to them and beneficial to them, because what the tools really do, they're ways you can integrate these interactions into the things you're doing every day. Like, you're going to the grocery store with your kid. How do you put some math in there or some language development? And you're already doing this stuff. You don't need more time. You don't need more resources. You don't need more money. It's just what are simple things you can do during your day when we already know parents are constrained and stressed and working really hard and trying and having a hard time already to make ends meet. But there are things that these parents, caregivers can do that are already integrated into their lives, even when they may be struggling financially.
I love that, Holly. I think the simplicity of the program and really reinforcing those teachable moments that just kind of pop up in your day and helping families recognize them and say, oh, here's a great opportunity for me to provide some open-ended questions or language or, tell a story, those types of things. So it's maximizing on those teachable moments, but it sounds like it's also providing a really firm foundation for healthy social emotional development. In addition to the academics, getting kids ready for kindergarten, it's also providing the strong bonds and relationships with the give and take between the caregivers and the child, some real positive things. So that's really encouraging. How does this align, so Connected Together as a collaborative that's part of Better Together and the Health Council, and, they have a couple different projects going on right now, and they've kind of taken on the basics of the Lebanon Valley. Can you talk a little bit about the connectivity between that and what that project looks like for them? I think Holly froze a little bit. So I'm happy to.
Okay.
Are you there? Are you there, Holly? Yeah. Oh, good.
I'm here. Okay.
Okay.
Yeah, I can hear you. Yeah, that's a great question on how it meets the initiative of the Connected Together initiative. As you clearly pointed out, that the basics are a great tool for intellectual and cognitive development of the young child's brain, but it's a great tool for in terms of social and emotional development, which is a big mission of the Connected Together network. The Connected Together Collaborative really looks at how do we look at resilience. And resilience is augmented with the connections we have with other people. And this is kind of doing that from day one, from an early stage, from infancy. And it's about parent-child connectedness, because we know a child is able to be resilient when they have a positive quality connection with a reliable and consistent caregiver, whether that be a parent, a grandparent, aunt, uncle, some meaningful adult in their life. And so this is kind of teaching those and facilitating and fostering those connections very early on and young in life. So what I really love about the basics is it's interdisciplinary. I mean, if you're an educator, you can love it because it develops cognitive and intellectual development in math and learning and reading and all that stuff. But if you're looking at this, the social emotional aspect of it, it also does that as well. So I mean, it's really like a win-win when you're looking at the overall outcomes.
Yeah. How has so I know you and I kind of found our love for the basics by happenstance, and I know you started using this a little bit in some of the work that you're doing at Lebanon Family Health and in connectivity with domestic violence intervention. Can you talk a little bit about what that looked like and how you got started with it?
Yeah, sure. Thanks. Yeah, Lebanon Family Health has been involved with the basics for over 3 years now. We've been utilizing it in the One Parenting program, as our program for parents of young children. And I'd like to highlight that this is a partnered program with Domestic Violence Intervention. We created this program together with DVI and integrated the basics into the curriculum because it does, again, meet all those things we've talked about, the cognitive intellectual development, but also the social emotional bonding that is so essential and important between parent and child. Because back about 3 years ago, we revamped the program to be more of a trauma-informed approach. And we saw the basics as really meeting that need because it talks about how do we make meaningful connections between parents and children from a very young age. And those connections are carried with them for life. And so when a child is in need, they will turn to the adult that they are bonded with. So therefore, they're going to turn, if that's the parent, they're going to turn to that parent because it's the person they've been connecting and bonding with since the beginning. That is why we call our program Be the One. You want to be that one meaningful, consistent, reliable adult in a child's life that they can turn to in time of need, because that's what resilience is. And I like to just share a little bit of just what we've seen anecdotally by using basics. As I mentioned, we've been using it for over 3 years. And what we see is when we use the tools that are available, like the videos and the worksheets that you can do, and there's a number of different tools on their website that you can use, but we use the videos and the worksheets. And what we've seen is when you show them to the parents and do them, it is incredibly empowering because they all of a sudden say, oh, I can do this. I've been doing this already. I just didn't realize how meaningful it is. So it's kind of showing them you just need to be a little more intentional with the interactions you're having. Yeah, you may already be singing with your kid. Well, maybe take that extra 30 seconds a day and do it maybe a little more. Take the extra minute to read a board book to your kid while they're eating Cheerios in the high chair. And it has this massive impact on that brain development and the bonding between parents and children. So it really, when we show it to the parents, it's just they realize they've got the tools in their toolbox already to do this, and it wakes them up to the reality that these interactions are very meaningful and they have huge outcomes. So that's kind of what we've seen anecdotally with the parents we have worked with, and that they're very simple. It's taking those extra 30 seconds, 1 minute here and there through the day, and integrating it into your everyday life, and they have great outcomes in terms of intellectual and cognitive development, but also social and emotional bonding between parent and child.
Yeah. You alluded to this a little bit about how this program can be attractive across sectors, the health sector, faith-based education sector. And so I'm wondering, what are some ways, or how do you envision other agencies or community groups becoming involved in this program?
Yeah, and thanks you. And that's really kind of what our initiative now is with Connected Together, is kind of how we grow this. Like I just gave you an example of how we've been doing it here at Lebanon Family Health for about 3 years or so. And now it's kind of like, how do we grow this bigger to hit our whole community? And the Basics uses a concept called socio-ecological saturation. That's kind of just a big wonky term for spread it everywhere. And it's kind of like looking at how other agencies, organizations can integrate it into what they're already doing and teaching these skills to their parents they work with, or even just random members of the community. Like how can we get into health centers and doctors' offices and libraries and faith-based organizations, employers, schools, housing, I mean, you name it, whatever places where you're interacting with kids. And also just people, random citizens on the street, when you may have an interaction with a child, what is it like just a simple, thing, a meaningful thing you can do to interact with this kid?
Yeah, that's great. So as this program grows, what do you envision, or what's the plan for the Connected Together group? Kind of what are some next steps that maybe you could share?
Well, we're now looking at how we can saturate the community with the terms, the concepts, where it becomes a common language of how we interact with kids in a meaningful and positive way. So some of the initiatives we're looking at are growing it in the community through those ALICE communities. And we're going to actually start with a launch in November 17th. There's going to be a launch in Annville. We're going to have a virtual town hall to share with Annville about what the basics are and how you do them, and share some of the videos and how that basics are applied. And we see it just growing through, teaching it to doctors' offices and libraries, and just other ways we can do this. Social media campaigns, billboards. There's lots of ways we saturate the community with. So I guess I just want to just highlight again, as I mentioned earlier on in this talk today. Lebanon County is the first and only community in Pennsylvania to be a Basics Network community. So we're really proud of that. So it is going to be called the Basics Lebanon Valley. We are the first, and we're going to be launching it in Annville on November 17th, and we'll be doing a virtual town hall to do that. And then we hope to do more further.
It's really exciting. And I think there's so much power in having a shared language and a vision for how we as a community can really support the positive growth and development of our youngest citizens. They're going to grow up and be our future workforce. And so, to be able to rally around that, especially during a time when, there's so many troublesome things happening. And so to have something to really latch on to, a strategy on, how do we build some resilience and build some really strong, positive connectivity among our families is, I think, really encouraging.
Yes, it is.
Wonderful. Holly, is there anything else you want to share with anybody who's watching today about the Basics?
Well, again, just remind them to keep their eye out to join the virtual town hall on November 17th. And if anybody really wants to have a presentation about the Basics program, please feel free to contact me at Lebanon Family Health, and I'd be happy to come talk to a community group about it.
Yeah, that's perfect. And I know, you had some connectivity already with early learning providers, with faith-based organizations. So really anybody could play a role in it. Wonderful. So thanks again, Holly, for your time today. And thanks for everybody for tuning in. If you have questions about the Basics or want to learn more, you certainly can reach out to Holly or myself, and we'll be happy to kind of bring you in on what's happening. Okay, great.
Thanks for your time.
Yep.
Thanks, Brooke.
Take care.